right, so thank you everybody for joining us at our monthly center-wide meeting. But we have a very special presentation today for Melanie Barwick. And the purpose of the presentation is to get us all better acquainted using the knowledge translation template. For all of us who are on the research projects and wrote the research projects for this RTC, we asked you all to prepare a KT template to help guide the knowledge translation activities of your research project. So having done that, we wanted to get the expertise of Melanie and Joanne Starks to guide us in that and actually start using it and understand better what it is. So that's why we asked Joanne and then Melanie to come on board with us to do this presentation. So I'm going to read briefly Melanie's bio. She's a senior scientist at the Child Evaluative Sciences Program of the Research Institute and the head of Child and Youth Mental Health Research Unit in the Department of Psychiatry at Sick Kids, the Hospital for Sick Children in Toronto. So, and she is also the developer of the KT template, and that's been sort of my Bible for the past 7 years of running knowledge translation here at UMass. So we're really very delighted to have her present to us personally. Okay, so I wonder where we should go. No, maybe we should go around. Go around? Okay.
Yeah.
So,
Yeah.
Thanks, Joanne. We'll go around in person here, and then we'll go through everybody on the phone. So this is Marcia Ellison. This is Mary Ann Davis. I'm the director of the Learning and Working Center. Hi, this is Catherine Sabella, project director for the RTC.
John Delman.
Laura Golden, I'm a research assistant.
Amanda Costa, I'm a project director. Tanya Dubois, I'm a research technician.
Hi, I'm Lisa Smith with, never mind. I'm a project for very existential questions. Melanie, it's so nice to meet you. We've been working on knowledge translation for quite a few years and I'm very involved in ourselves. So it's really a pleasure to have you present with today. I'm Jennifer Whitney, a research technician. Kate Feeble. Same question. Yeah, faculty person, assistant director center here. So thank you, and Gary, want to say hi?
Hello, this is Gary.
Hi, Gary.
From Dartmouth.
Thanks, Gary. Anybody else on the phone?
Joanne, I can go ahead and introduce myself. Joanne Starks with American Institutes for Research, and Disa May Smith and I will be working with you guys on following up with more knowledge translation activities. I think Disa's here too.
Go ahead, Disa. Do you want to say hello? Not yet?
I wonder if it's not working for her. I see her is unmuted, but...
Okay.
Well, welcome anyway, Disa.
All right, thank you all. Okay, Melanie, please take it away.
Sure. So thank you again for the invitation. And I've done a few of these run-throughs, but mostly with people who haven't tackled with the knowledge translation planning template, and I understand you all have. So I'm preaching to the converted. You may not have any questions whatsoever. I'm going to try and get through this in enough time that if you do have questions about specific sections or thinking things through, that we can have a conversation about that. So next slide, please, Joanne. Is it Joanne who's moving them or Kimberly?
It's Kim.
Okay. So I'm just going to review a little bit of the relevance of KT planning, generally speaking, and I think there's some similarities between our context here in Canada and your context in the U.S., particularly for NIDLR funding. And then we'll review the components of the KT plan and just kind of go through it and then see if there are any questions as we go through in terms of what you should be thinking about in any of the specific sections. Next one. So been thinking about this since I've been working on this and since I developed it in 2008, and I find there's still some relevance to reviewing for people why we're even bothering to do this. A lot of the time people come to thinking about knowledge translation or even planning for knowledge translation because they're applying for funding and it's a requirement of the funder. And the important external driver in Canada, and I understand it's now, it's taking shape in the U.S. and other countries as well, and it's an important driver relative to you all thinking about knowledge translation from the perspective of who are you going to partner with, what are the relevant messages you'll have to share at the end of your research, and how are you going to share them, and with what goals in mind, or what knowledge translation goals. So for us, they are, it's often a requirement of the research proposal submission. For us, it's also a requirement of our CVs. So our three major health funders, or rather federal funders in Canada, we have a common CV, and there's a large section there to report on our knowledge translation activities, and so we have to do that. And then the other driver is that when our funding is finished, and here I'm particularly thinking about funding from Canadian Institutes of Health Research, which is, similar to your NIH or NIMH. They're asking for quite a lot of information online now. It's an online final report format around, who we engaged with in terms of knowledge users and how we engaged with them and what our knowledge translation outputs and deliverables were and what were the impacts of those activities. And so it's really pushing people to think about that evaluation piece. And much of this is really framed around thinking about who the knowledge users are beyond the other scientists that are working in this field. Because of the nature of the work that you all are doing, I know that notion isn't lost on you. You probably work very interactively with a range of knowledge users and partners. For some scientists, that's a new concept, and so thinking about, well, who needs to know about this research at the end of the day, and do any of those groups actually warrant my reaching out to them early so they can be involved earlier in the research development process, the proposal development process, to lend their perspectives to the types of questions that are being asked in the research, the methodologies and procedures, the feasibility of doing particular research, and help with, early stage interpretation of research findings as they come in, have a dialogue about them, and then think through who needs to know, what do they need to know, how do we distill that, and availing ourselves as researchers, availing the pathways to key knowledge user audiences that can be brokered by involving those knowledge users right from the beginning. And after we often find, all of this knowledge translation activity is over and above, the key scientific impact, which is journal publications. That's still, nothing's changed there. We still have to write journal publications. It's still the primary means by which we demonstrate our productivity and the quality of our work, and the primary means by which we reach out to other researchers working in our field. But more and more we're recognizing that we need other modalities of sharing our research findings, because largely they sit pretty much unread, whether it's in a journal or in a final report somewhere. And so what are different ways that we can shape our research findings in different formats for different types of knowledge users so that they can access it? It's an accountability issue as well for many funders, for many organizations, where we're being really asked to demonstrate the impact of our research, what was done with these research funds to advance science and to advance practice and to improve the quality of life for people in our countries. And, you know, it really comes down to the fact that if you don't plan to do knowledge translation, it's not going to happen. You're going to have your research funded to a certain amount of money for a certain amount of time. You're obviously going to spend the majority of your energies conducting that research. And it's very easy to finish it up, tie it up, write that publication, and sometimes not so easy to write that publication, but write that publication, and then, you know, the other activities kind of fall by the wayside as you move on to the next work. So it requires some advanced thinking and mindfulness about how you're going to do this piece. Next slide, please. So we're thinking about knowledge translation essentially with the postcard destination of getting what we know works to improve health and well-being into the hands of people who can apply it. And that's a pathway. And next slide. That pathway, you know, in thinking about how to get there, how to get through that journey, we want to address particular key components of a knowledge translation plan. So if you can just click through these components, please, so that they just appear. A lot of people jump the first one, which really has to do with what are your knowledge translation goals. And by this I mean, what's your goal in communicating your main messages to your particular target audiences or knowledge user audiences? What is it you're trying to accomplish in communicating what you've learned? Thinking about who needs to know. So number 2, thinking about how you're going to engage those knowledge users and when you're going to engage them. So that speaks to my earlier point of, you know, does it make sense to engage a particular knowledge user group early on so that they can be more involved collaboratively in a participatory way as your research unfolds. Thinking about your main messages. So by main message, I'm really trying to capture here the knowledge nugget, the main essence of what you're trying to communicate. And that requires some thinking through sometimes, because as a researcher, what I may see as, or what I may perceive as my main message may not be what a particular knowledge user audience may think is the main message for them that came out of this work. So, you know, another reason to interact early on with your knowledge users, to get a sense of what are they going to think is important, what are they looking for to get, what are they looking to get out of this research, and then how do you shape that main message. And the other difficulty that people have with main messages, particularly researchers, is choosing a few versus a lot, and making them concise and plain languaged. I heard a good quote the other day about, someone said a good conversation, so you could say a good main message, is like a mini skirt, short enough to retain interest but long enough to cover the subject. I think that's pretty accurate. You don't want to go on and on, you want it to be pretty concise and tight. And then thinking about your knowledge translation goals, what knowledge translation strategies are you going to use to meet that goal? And then how are you going to implement those strategies? If you're using educational materials, how do they get developed and implemented? If you're using webinars, how do they get developed and implemented? Plain language summaries, communities of practice, whatever strategies you're thinking of doing, clinical guidelines, implementation of an intervention. I see many of your proposals are focused around services and programming and you know, coaching support, so developing innovations, if you will, which would then need to be taken up in a variety of different contexts. And then thinking about evaluating that. Did you actually meet your KT goal through the strategies that you engaged in? And then lastly, thinking through what resources are required, because if we're thinking about this prospectively as you're writing this, to think through to be a component of your research proposal and your submission, being really clear on what you want to do and what it's going to cost to do that, make sure, helps to make sure anyway that you have money in that sort of pocket to do that work. Next. So knowledge translation goals and effective KT go hand in hand. So thinking about why you're communicating what you learned. Sometimes this has to do with the purpose of our research, and sometimes we are limited by the quality and amount of research evidence that is behind a particular point we're trying to make. When we do one study, we may not necessarily be looking to change what anybody does out there in the real world, but we certainly are looking to build awareness and interest about what we've done, share knowledge about what we've learned, probably also inform future research. We may not yet be ready to engage in practice change or policy action or mobilize the public in some way. That oftentimes will come out of research that has a substantive synthesis behind it in terms of a high-quality body of research evidence that's saying, yes, this is really the way to go. And so it's just, you know, a good grantsmanship and sort of a research caveat to think about not rushing into wanting to implement innovations that you may have developed in advance of their replication. So that's just something to think about. And then, of course, sometimes we want to commercialize a discovery or an innovation, and that would also be a knowledge translation goal that follows a different pathway. Next slide. So some specificity about thinking through who your knowledge users are, who needs to hear this, how well do you know them, in engaging with them and sort of bringing them into the fold of your research group, thinking about how prepared they are to act on any information you may share with them, and what blocks or impediments or barriers they have in interacting with your research project or even utilizing or putting into action any of the recommendations you may make that emerges from your research. Next. So be specific about how many knowledge users you want to reach out to, but be practical. You certainly are not going to develop a knowledge translation plan that has sort of the whole gamut of everybody on the list unless you want to be highly resourced to do all of these things and you have a big team. You know, a better approach is to kind of say who are the first, second, and third ranked knowledge users that are really pertinent to what I want to share, and focus in on making sure that they're engaged and that they understand your research evidence. So just a caution about not trying to do too much given the time you have, the resources you have, and what you're trying to accomplish. Next. When I read people's knowledge translation plans, what I often see a couple of flags for me when I read their plans. Maybe we can come back and you guys can tell me whether your plans have been structured, you've written them this way. I often see plans that are not aligned, and so a first sentence will talk about who the knowledge users are and maybe a sentence or two about what the KT strategies are without kind of lining that up. This and with an absence of KT goal or evaluation of whether you met that KT goal. So lots of holes, and that's Swiss cheese. What you want to be doing is thinking very systematically through what's the main message for that knowledge user, how are they engaged, what strategies are getting that main message across and meeting your KT goal for that message and that user, and how are you going to know you met it. And so I usually structure my knowledge translation plans in two ways. Two large sections, one being on integrated knowledge translation, which is to say, what are the knowledge translation activities that are very participatory and collaborative with my knowledge users. And then the second section is about end-of-grant knowledge translation activities. What am I doing at the end when it's all finished? And with each of those sort of paragraphs or sections, I identify goal 1, 2, 3, and 4, however many goals I have. What's the first knowledge translation goal? Who does it involve? How am I meeting that goal? What are my methods and procedures around my KT strategies? And how am I going to evaluate the impact? and I just do it that way. That's how I structure it, so that it's aligned, but it makes sense. And so if we don't evaluate, we're not doing great knowledge translation, because we don't know whether the webinar accomplished what it set out to accomplish, the guidelines even being used, people are using our intervention, and so it really reflects a suboptimal return on the research investment and an unrealized contribution to KT science, because what you're doing here by not evaluating is missing an additional opportunity for productivity and contribution as a small paper on the knowledge translation strategies and methods you used, for what purpose, and how effective they were, which could be a separate paper from your general research paper. Next slide. So I've actually sort of inadvertently touched on these sorts of things, just to be mindful of completing the whole cycle. So identifying the goals, planning, picking the strategies, actually implementing your KT strategies and putting your KT plan into action, evaluating it so that you can validate what you've done. And that validation piece, as I just mentioned, may lead to another publication as a secondary publication, but it also does two other things, sort of top of mind. One is lets you know what kinds of strategies you've used that were effective that you, may use again, right? So on the next project, if it appears that this particular KT strategy that you used wasn't really effective, having evaluated it informs how you might formatively improve upon that or switch to something else entirely. And it also helps to maintain your credibility with your knowledge user audiences. This is what we did, this is what we learned, this is how we shared it, and here are the impacts of how we shared it. And that looks good for your knowledge users. Next slide, please. Next, yeah, let's just, this is supposed to be sort of an interactive thing, so let's keep going. So evaluation approaches that I think about relative to knowledge translation. You can click through that whole slide, so that's good. So I often go with indicators, and I'm going to take you through some ideas about indicators for different KT activities. But you might also think about learning outcomes if what you're doing is training or sharing knowledge through a webinar. You know, Kirkpatrick model is a good thing to sort of think about what level of learning has occurred, thinking about adult education learning models. And then if what you're trying to accomplish is practice change or behavior change, and you are moving into that subspecialty area of implementation science, you'd be looking at evaluative approaches for implementation effectiveness. So however you want to define that, whether it's the re-aim or the stages of implementation completion model or any of these things here, the NERN model, you'd want to sort of be informing your approach to the work that you're doing using those different implementation effectiveness models. Next slide, please. So when I talk about impact, I'm not talking about scientific or academic impact as much as I'm talking about KT impact. So there's a lot of impact work at the national level, international level, but in sort of countries looking at how they can demonstrate the contribution made by the research that gets funded. When I'm talking about impact in the context of KT planning, I'm really talking about how can you demonstrate that your KT activities achieve the stated KT goal based on the research outcomes and the outcomes that you've evaluated. Next slide. So, you know, we currently look at impact, sort of big impact, by things like, you know, journal and what I would call productivity indicators, but we really need to start to look at other metrics. And so insofar as many of the KT strategies are now using social media channels to share information, we have now the benefit of a whole realm of what we call alternative metrics or altmetrics to capture things like spread, to capture things like you know, who actually saw the material that you put out there on the web, These are important indicators, but be mindful of the fact that these social media metrics do not tell you what people did with the information that you shared. And that's really what you want to capture in terms of how do people, what do people do with the information you shared with them? And what was the impact of that? That's what you're trying to capture here. Next slide. Yeah, so impact has to tell you or show you that people knew what to do with the knowledge you shared and that they understood it. And so how are you going to reflect that? Next slide. One of the ways I like to conceptualize that goes, you know, where I'm trying to have an impact with the sharing and the evidence that I've produced is by using this framework. This is an Agency for Healthcare Research and Quality framework. 16 years old now, but it gives you a way to start to think about how big am I going, what kind of impacts do I want to have. The level 1 impacts are really, you know, impacting the research and impacting future research, and that's a no-brainer. We all have to do that. Do we want to impact health policies or services? And I can see that many of you, and with respect to the abstracts that were shared with me, are looking at impacting service, impacting clinical practice, and with a long-term view of impacting health outcomes. So being clear on what it is you're trying to have an impact on and how you might demonstrate that is a good place to begin. Next slide. So let's look at some indicators for use and evaluation. Next slide. One of the resources I use heavily is this guide, and it gives you a way of thinking about how to evaluate products. And since a lot of our knowledge translation are products in the form of KT deliverables, it's really useful relative to thinking about indicators for your KT activities. Next slide. So thinking about reach indicators, for instance. You might have learned something, you have formatted it as an infographic, a plain language summary, something developed for your community readers or your stakeholders or knowledge users. So thinking about where that goes, how many people download it, what kind of media coverage or media hits do you have, where is it indexed, what other websites are linking to information that you've produced and any of your KT deliverables, which you can look at on the web. There are search engines like Alexa.com where you can put in your URL and see who else is linking to your website where there's probably information that's come out of your research project. Next slide. Quality indicators. So again, this is the kind of stuff you're not going to get by your Altmetrics or your spread indicators from Google Analytics or what have you. This is going to require a different methodology to get at, you know, when you shared this information, did people actually interact with it? Did they read it? Did they browse it? Did they share it with anybody? The sharing piece you can get at electronically. How usable was it? Was it useful? Did they gain knowledge from it? Did it change their views, their attitudes, their practice in any way? And so thinking through if that's what you really want to know whether your KT goal was met and you were effective, you have to come up with kind of an easy, simplistic way of surveying knowledge users who received your KT product and asking these kinds of questions. Thinking about the quality of what they've received. Do they perceive it as quality, high quality? Do they perceive this information as being highly credible? Next slide. Thinking about use. The number, the percentage of people who are your knowledge users intending to use the information that you generated from your project, or adapting information that came from your research project. How are they going to use it to inform policy, to teach, to advocate, to enhance service delivery, for research purposes, to improve their own practice or performance? So these may be some of the questions you might want to be asking. Next slide. Oftentimes when we're working with a lot of partners in a very integrated KT or collaborative fashion, it might be useful to get a sense of how good that collaboration actually was and whether you built capacity. Sorry, I'm just going to mute my phone. And so, you know, thinking about what kinds of collaborations emerged, how can you characterize or describe those collaborations? Were they within the organization? Were they from within the organization to outside the organization? What sorts of capacity building or collaborative efforts did you engage in as part of the knowledge translation for your project? Next slide. One of the tools I have used to get a sense of the quality of a partnership or a collaboration is a tool developed in Ireland by Ireland Public Health called the Partnership Evaluation Tool to try and assess 4 key areas of good partnerships. The extent to which connections emerge from the partnership, learning, actions, and impacts. And so it's structured as 2 different questionnaires, one that's given in advance or at the early start of a partnership to get a sense of the partner's perspectives on how important do you think it will be to have more connections as a result of this engagement, or to have learning come out of it, or to actually do some things together and to have an impact with the things you do. And then you go back with a second questionnaire to ask questions about, okay, well, you ranked the importance of connections as 5 out of 5. What was your actual experience? And maybe they rank it as a 2. You can flip to the next slide, please. And you can compare that with a spider graph and kind of show, look, people's expectations about where this collaboration was going to go, this sort of integrated knowledge translation was like this, but here's what we actually accomplished. Or maybe it mapped well, one upon the other. So with all of this thinking about the different components, developed the KTPT, you can flip forward. This is just a URL where you can find it. If you ever misplace a copy that you have, you can download a new copy. Next slide. And so going through it, you're simply identifying, as you work through your different sections, who are the project partners. And this is your opportunity to think beyond the researchers and the research team. Are there knowledge user audiences that you want to include? And are they included early on, and what's the value of doing that? You might want to, again, depending on what your funder requires, be able to describe that degree of partner engagement. So moving to the second column. Were the partners involved in generating the research question and design and the proposal? For us in Canada, sometimes that is a requirement for a particular funding opportunity. For instance, we have funding opportunities that require you to have a nominated primary investigator and a nominated primary knowledge user. And so they're engineering it so that your partners and your knowledge users have to be, in order to get the money, they have to be with you on the ground floor. And so thinking that through is going to be part of what's the best way to work in the space to answer the questions that you're asking, and what are the requirements of the funder. So in the third column, thinking through partner roles, what do the partners bring to the project? Why are they involved? Why are you bringing them in early? What are they assisting with? The development, the implementation, the evaluation of the KT plan. What are their specific? You may also have requirements when you identify partners that are non-academic partners to have letters of support alongside your proposal. And so this is where your description of what they're doing should align with what they're saying in their letters of support. Column 4 is really thinking through, okay, well, I'm going to be doing knowledge translation, so what kind of expertise do I need on my team? Do I need scientists with KT expertise? Is it sufficient to have a consultant or a knowledge broker or a specialist? Are there any KT supports within my organization on which I can draw, or might I be thinking strategically about partnering with another organization that can lend their KT expertise or the resources they have? So as a concrete example, research that I've done in the past, I've partnered with an organization that has credible access and channels of communication already established with the knowledge user groups that I want to reach. And they also have resources structured in a way I want to use them. So perhaps I want to do webinars and they're already set up with all the webinar technology. That reduces the funding burden, the budget burden on me, and aligns my purposes with a group that is already ready to go. Next slide, please. So who are your knowledge users? And again, you know, while these are listed consecutively, you're thinking about this knowledge user group at the same time as you're thinking about main messages and KT goals. So, you know, who are the knowledge users for this particular research? And in case you haven't carefully thought about what you said in column 1, there's a little note at the bottom here that says, have you included any of your knowledge user audiences on your research team? And maybe this is just a little reminder that you might want to think about that. Main messages, right? So what did you learn? What do you anticipate learning? And you can identify sort of the gist of what you might want to communicate, maybe not with specificity, and which knowledge users need to hear what specific things. Or you simply may, oftentimes, prospectively not have any idea. But you want to give your funder, if you're writing a proposal, an idea that you understand the knowledge translation process and how you're going to work collaboratively, for instance, to come up with your main messages and then figure out and refine your KT plan. You know, as with every other aspect of proposal writing, you kind of have to have enough of a plan so you know how to budget for it time-wise and monetarily, but some flexibility so that things can emerge and you can deal with them as you see fit. So in column 7, for those 3 knowledge user audiences that you've identified, you're identifying the KT goal. So maybe knowledge audience, user audience 1 is researchers, and 2 is decision makers or service providers, and 3 is parents or consumers. Thinking about, okay, given what it is I'm researching here, what do I want to be telling them and why am I telling them? Here's your, you know, what is the KT goal? And then to think through in column 8, what strategies lend themselves best to accomplishing that KT goal. And the way we've structured this here is really based on a systematic review published in 2003 in The Lancet and a couple of other places around KT strategies that are mostly effective for practice change, have mixed effectiveness, and limited effectiveness or unsupported from a synthesis perspective. We've structured it that way even though that data is kind of old and out of date, just to give people a bit of a frame. But you know, keeping in mind that you're going to be evaluating your KT strategy yourself, it kind of loosens up this notion of, well, what's highly effective for what kind of thing. We've never really accomplished that sort of a formulaic matrix where you can identify your user audience and your KT goal and say, oh, that's the best strategy to use. There's always going to be some iterative thinking and reflection going into what's going to be the best approach. Next slide. This column 9 is probably more Canadian in the sense that we often have to think about how we're going to describe our KT activities from the lens of integrated versus end of grant. Might be helpful for you, might not. And then column 10 is really thinking through that KT impact and evaluation. So in section A, it's that Agency for Healthcare Research Quality triangle, where do you want to have an impact? And then in section B, it's being reminded of the different kinds of indicators captured in that Sullivan resource that I took you through. Is it useful to have reach indicators or usefulness indicators or use indicators or partnership indicators? If you're going for practice change, how are you going to set that up? Are you looking for service indicators, policy indicators, et cetera, and then building your evaluation framework from that. And then Section C really has some questions for evaluation that are sort of driven by general evaluation frameworks, developmental evaluation, and that sort of thing. You might sit down and develop your KT plan with your knowledge users and your stakeholders, in which case some of these questions would stimulate a dialogue around how are we going to know that this KT plan was effective for us. Next slide. What resources are you going to need to actualize your KT plan? How does that map onto budget items? And then lastly, you've described your strategies, your KT strategies. What's the methods section of your KT strategies? What are the processes and procedures involved? This is kind of the nitty-gritty of, well, how are you actually going about putting your KT plan into action? If you can sit down with your team and work through this, as you guys have had experience doing already, you're in a good place to be able to write a couple of paragraphs of prose to include in a proposal that details in a very structured, systematic way what your plan is for translating that research evidence to a variety of knowledge users with particular KT goals in mind, and with a bit of a plan, depending on how much you have in terms of resource and time and team, to evaluate whether you actually accomplished those KT activities successfully. So I think that's the last slide I'm going to say. Just a little pitch for the KT game, which is the template in card game format. Next slide again. I think that's it. Yeah. So happy to answer some questions. I think we have about 12 minutes until 1 o'clock. If there are any issues with any, aspect of developing your own KT plans, let's hear them.
Well, thank you, Melanie. That was really a